Well, to compare hospitals in Dublin to hospitals in the Midwest and West is apples and oranges. I mean, Dublin have Model 4 hospitals all over. In fact, I think in Jennifer Carroll MacNeill's area, she has 5 Model 4 hospitals within an hour. So to compare that to somewhere in Galway is unfair, number one, and they don't have the facilities, number two, and that's really her job.
And seeing that comment that Cork and Galway have consistent pressures, did that surprise you, given that day in, day out, if we're to look at INMO figures, UHL is the most overcrowded hospital?
I was actually surprised that UHL wasn't in that list, and to be honest, and then I looked further down and heard the article and then realised that she did mention UHL eventually at the end. But I was very surprised that UHL did not come into that list, because we are consistently overcrowded and we have consistent trolley numbers that are higher than most other hospitals. And possibly Galway is bad now, because if Limerick is full, most people will try and get to Galway from Clare.
So there's a relationship there and a knock-on
I
effect.
think there is. I think there is a knock-on effect, yeah.
When she was referring to University Hospital Limerick, she did acknowledge that there are challenges and that there is overcrowding, but said that you couldn't blame management. Do you think that's fair? Is it fair to say that management are doing all that they can, or should there be additional pressure put on there?
I think the blame has to land firmly with the minister, because we have been without a hospital here in Clare, and we've repeated this on numerous occasions. She has been down here, she has seen it, she has realised that there is no backup for UHL in Clare. In other words, step-down beds aren't available anymore because they're literally full. So to say that 100 people on trolleys in University Hospital Limerick is okay is wrong. Anybody on trolleys is not okay, and 100 on trolleys is definitely not okay. There are 100 very sick people waiting for beds. This 96 block that came in there 2 or 3 months ago has not alleviated any pressure off UHL, and we had said that from day one. The only way we can relieve pressure from UHL is to build a Model 3 or 4 hospital in Clare.
Just finally, Hilary, the Minister also mentioned capacity at University Hospital Limerick as a problem, of course referring to her commitment that she's made in recent weeks to boost capacity at UHL. We had a conversation with yourself very recently about parking at the facility, which is a problem that a lot of people are speaking about now when they are talking about bringing loved ones to the facility, or indeed trying to get to appointments there themselves. Is it a moot point talking about improving capacity at UHL when, as it stands, it's so difficult to get in there, to find a space and to get to your appointment on time?
I do think it is, and we were talking about the parking before, and it's impossible. I've heard of people literally dropping sick people at the door and having to drive on because there's a queue of cars behind them. That's no way to treat sick people, and we've known this for a long time, Sean, and it's about time really that they started looking at, as we call it, option C, and get on with it as soon as possible.